To chapter 16 and our core training concepts chapter of the 7th edition of the Nasm CPT manual, the essentials of personal fitness training. Here we're going to dive into, so again, we kind of are on that building block pattern here. That flexibility chapter was first, I believe it was chapter 14. Chapter 15 was cardio, chapter 16 is core, and then we'll keep progressing through, just like you would be building out a program for somebody in this sort of realm. So we're gonna, Nasm recommends going in this order based on their OPT model. There's your learning objectives down there on the bottom. You can take a look at those. All right, so really what we want to understand here is that, core training is really critical for many things. Core centralized, meaning centralized. So posture is going to come from that, enhanced or improved performance, reduced injury reduction, and then speeding up the injury healing process or the rehabilitation. All right. So those are the key components of that core training. So inside of that core training, we have three different terms that we kind of want to refer to: core stability, core endurance, core strength. Now, core stability is just like it says, the ability to maintain a given position and stabilizing the spine for a period of time while also having simultaneous movement of the limbs. Okay, so that's core stability. We're taking and stabilizing our central section, and in that same process, we're also allowing for proper movement to occur so that the spine is not compromised. Now, core endurance is basically being able to go for a given duration of that core stability. All right, and then core strength is ability to control the motion of the spine, based on again, if you lack it or if you are enhanced in it, the lacking will just have a lack of control. Whereas if you have good positive core strength, that just means that your spine is able to be controlled during motion. So again, with everything that we refer to with core training, there's different levels, local and global musculature, that will help us to stabilize the spine. It will allow us for proper movement with that stabilization. So that's what we're going to be referring to as we go into the next section. So the core musculature, regarding the lumbopelvic hip complex or the LPHC, all right, we're working here with that lumbopelvic hip complex. We're really working around that, the center of gravity of our body. Again, in simplistic terms, although it's not the same for everybody, if you think about just taking your finger and poking your belly button, that's usually a really good indicator to where your center of gravity is, right? But when we talk about that specific region, we're talking about the abdominal region, the hips, the gluteals, minimus, medius, and maximus, and then your low back region. Okay, so we're going to divide these regions into, like we said, local and global groups of muscles. All right, and their job is to basically work in sequence, especially during movement, to provide a stabilization of the spine, and then obviously that simultaneous movement, like we talked about. All right, now again, what we're going to have good quality trunk movements. At the same, our trunk is able to maneuver, especially with that lumbopelvic hip complex, and so what we're doing is we're getting a good stable spine, and we're getting a trunk that can move in any direction that it needs to, depending upon obviously what the demand is calling for. So your local muscles, they're what we would consider them primarily type 1. Okay, type 1 meaning they're more aerobic. That means they don't fizzle out very quickly. They're more endurance based. And that's really important because you would figure your posture would fall apart if they were type 2, because they would get fatigued out very quickly and they would have to be shut off and then rested and then turned back on. Whereas type 1, they can, basically we're not talking about high intensities here during natural movements, but understand that, as intensity of resistance training or whatever, or power training or whatever we're doing ramps up, these muscles get taxed a little more, but they're still endurance based. All right. They stabilize the spine and they work on maintaining that posture. So looking at the muscle groups, the rotators, the multifidus, the transverse abdominis, the diaphragm, the pelvic floor muscles, and the quadratus lumborum. Those are your typical areas that we want to refer to. All right. So when we look at, the main focus patterns here, the rotators, what we're talking about here are of the spinal segment. If you look, these are more like your erector spinae muscles. All right. Your multifidus is something that it's basically the next layer of that. So, the rotators, they stabilize and rotate the spinal segments. The multifidus stabilizes and extends and rotates. So again, when those contract, they will pull you in specific regions. All right. And, again, the other set is your transverse abdominis. So working on intra-abdominal pressure, very important for when we breathe. And then your diaphragm, again, your big your inspiration, your inhaling muscle, it relaxes on the exhale, right? That's the key component to that diaphragm. But again, setting that diaphragm sets those local muscles to allow us to have that very positive spine positioning that we want, so it's not compromised. Then you also have your pelvic floor muscles. This is, look, if we had like a cross-sectional area, if we cut you in half and look straight down, you can see your pelvic floor muscles sit right inside of that pelvic region, allowing for all directions of pull. So it's keeping your pelvis supported and in alignment. So if any of those pelvic floor muscles become imbalanced, that just means that you're going to have a shift in your pelvis and your hips. Then we go into your QL, your quadratus lumborum. Okay, again, connecting from, if you look, it really connects from your lower rib through the spine and then down into the very top of your iliac crest. All right, and so because of that, what it allows for is that lateral flexion of the spine, meaning if you were to stand up straight and bend directly to your left or to your right, all right, that will be lateral flexion and then elevation of the pelvis because of how it connects in an upward fashion. Okay, you have a more vertical line, so that allows that elevation to occur of that pelvis. So if your quadratus lumborum or your QL becomes very tight, you can see here that if one side, if we look onto the left side of, or left side QL, if that becomes tight, that's going to pull that left hip up, whereas the right side will either remain the same or start to sag a little bit, and we would call that a hip hike. So moving from the core local to the core global muscles, they're predominantly, they don't have a predominance. They're more type 1 or type 2. Now, again, genetics can play a factor in that as well, but particularly we're looking at a combination of them. So what is it that we're looking for? They move the trunk. All right, they transfer loads between the upper and lower extremities. That's their UE and LE. All right, and then they also provide stabilization of the spine. This is where we would have those concentric and eccentric actions. So we're talking about more muscles that we recognize a little bit more. Rectus abdominis, external and internal obliques, your erector spinae, your gluteus maximus, your lats, and then your hip flexors, including your iliopsoas, which is your iliacus, and your psoas muscle groups, which is basically combined. So your rectus abdominis, again, very common for us to, point those out. Centralized region, all right, what do they work with? There's those primary actions: trunk and spine flexion, rotation, and lateral flexion. So again, side to side. External obliques, the ones that are more pronounced on your lateral sides of your abdominal region. Spinal flexion, lateral flexion, and then contralateral rotation. Now, contralateral rotation, meaning that if you want to rotate, so if you were standing up straight and wanted to just rotate yourself to the right while leaving your hips and legs fixed, what would happen is the external obliques work contralaterally. They work opposite. So the right, if you're trying to turn to the right, the left side will actually assist in that spinal, in terms of that spinal rotation. That's what we're referring to there. Now, this looks like so if we look in the internal obliques, we'll kind of cut down off of here, and I'll kind of go into, if we go through and move into where we would find there's our local muscles and there's our global muscles. So we'll go into that little picture base here. Internal abdominal obliques, you can see those run more inferior, more underlying than your external obliques. See how the external obliques are on the left side here. the internal obliques would run on the lower port below that section. So spinal flexion, lateral flexion, and ipsilateral rotation. Now, contralateral meaning opposite side, ipsilateral meaning same side. So if you're working on rotation to the right, your internal obliques will pull with the right side to turn you to the right. And then as we go through your erector spinae muscle group, those are the large muscles that sit over the top of your rotators and your multifidus. All right, you can see they kind of cover that, and they're very, very important for all aspects of extension, of the trunk and the spine, rotation, and then lateral flexion as well. Okay. So moving back from there, the iliopsoas, you can see, is now a hip flexor. It connects directly to the hip, right down, and it connects all the way down to the top portion of the femur. Very big, obviously, on hip flexion, but because of where it's placed on that medial side of the femur, it can allow for what we would call hip adduction and external rotation. All right, so when they contract, they will pull in those manners. Now, like I said before, the iliopsoas is a combination of the iliacus and psoas group. All right, whoops, a little too quick. And if you look, there's your two combinations that work in sequence. Okay, and so really, we want to make sure that when those two are working correctly, they're two predominant hip flexors connecting very similarly to the same positioning. That's why we kind of lump them together. So then your lats, are wings, as some people will say, trunk and spine rotation. You'll also get some shoulder extension, some adduction, and some internal rotation of those. Now, we assume that the lats work with the back, and we assume the back is part of the upper body. But just understand the lats are a really important core musculature. They really are important because of where they connect down through the spine. All right, and they connect to the fascia, the thoracolumbar fascia that runs, above that spinal region. So it has a really big implication on all things spine and trunk. Okay, so if your lats are, asymmetrical, or they have improper length tension relationships, they can really throw off your hips. They can throw off your true pelvis. They can throw off your spine, and really cause complications and eventually lead to pain or injury. So what do we have to recognize after we have local and global? Okay, well, why do we want to properly train? Basically, we want to make sure that we have proper development of all things strength, power, and endurance. We also want to make sure that we can have people move dynamically in a more, physical sense, so that we can try to avoid having complications with movement like falls and injuries. All right. Now, without being properly trained, we are really taking and putting our spine, in a compromised position, and we lack that what we would call intervertebral stabilization. So we're losing that stabilization between each vertebrae as it goes from C1 all the way down. Truly, if we talk about just the spine, I know it's part of your vertebrae system, but we'll just say from C1 all the way down to L5. We'll not talk about the sacrum or the coccyx at that point. We just want to talk about the upper portion. But obviously, there can have an impact on those regions as well. If the global muscles are strong and local muscles are weak, what you're going to have is improper transfer of force, and you're going to end up with imbalances that will occur. You'll end up with non-stabilization of the spine and the trunk in unison. So you'll end up with potential injury or pattern overload that isn't really necessary. So we want to make sure that we don't have that loss or that weakness, okay? Because poor posture, our performance will decrease. Now, don't think just athletic performance, but performance of movement for all ages. There is, again, that increased risk of injury, and then you're going to have a hard time getting back to returning from an injury if something were to occur. So core musculature will help in speeding up that process. So we want to make sure we optimize posture. We kind of hit on that before, but we want to maintain the natural curvature of the spine. Now, if we look, this is the lateral side. This is from a lateral viewpoint. Now, this is technically if we were looking at somebody from their right side. All right, cervical spine, moving down through your thoracic, moving down through your lumbar. There's your sacral and your coccyx region. Again, we've hit on those areas in previous chapters. So, again, we know about that curvature and we know what it's supposed to look like. Okay? But just understand you have an outward curvature, an inward curvature of your inward curvature of your cervical. You don't want that to be straight up and down. There needs to be a slight shift in it. All right, not too crazy, but enough, because if you have a straight neck, that can actually cause problems with your spine as well. Moving down, you're going to have an outward or a convex shape of that thoracic moving outward. Now, it does say kyphosis there, but if it's exaggerated, that would be where we would talk about upper cross syndrome. Lumbar moving back inward, more lordosis, but again, too much lordosis could lead to lumbar or lower cross syndrome of the lumbar region. And any of those would lead, so if you have an issue with any of these areas, particularly if you have like an exaggerated lumbar curvature, that's where we would have what we call anterior pelvic tilt, where you're basically dumping the pail of water forward because your hips will almost like they want to bend, they want to bend and they want to dump out water. If you have an issue with your thoracic spine, or even if it's calling upon specific musculature like tight hamstrings or rectus abdominis regions, that can cause you to have a posterior pelvic tilt, or what we would say is the pail dumping backwards. Okay, so posture is going to be really important for that, helping with proper spinal health. Now, there's your anterior and posterior pelvic tilt. You can see how at different points the underactive abdominals and the overactive erectors will cause that big curvature of the lumbar spine, and you can see the hips will tilt forward. Okay, whereas overactive abs can cause that shift, and then also having overactive hamstrings, you're basically kind of pulling up and down simultaneously, which is going to rotate the pelvis backwards, and that's kind of what we look at. The pelvis will shift, and you can see the angle of your hip changes dramatically in both sides. Okay, more forward for anterior, and obviously more backward for the posterior. So we know that there can be these deviations, but understand we can also have side-to-side deviations, which we would call scoliosis. And if you look, it's that lateral curvature. That there is away from the midline. So what we want to do is we want to make sure, because scoliosis is so structurally unsound and it puts a lot of, additional strain on the spine and causes pain, we have to find ways that can help that scoliosis. So, because typically with that spine shifting laterally, it's going to cause imbalances from the left and right sides of the body. So core muscle strengthening can help offset some of this. From a personal standpoint, I know from my own work that I've done with people, working in a deadlifting program and putting more deadlifts into a person's regimen actually has helped them, because if all the musculature that is sitting over, as we said, the rotators, the multifidus, and then the erector spinae group, all of those muscles, when they fire from deadlifting, will contract the spine to make it optimal, meaning that when it contracts, it wants to maintain the shape of the spine, but it also wants to pull correctly. So when it pulls correctly, over time, what it'll do is it'll create a less deviated lateral spine, so therefore it can become a little bit more straight up and down. It may not fix it completely, but understand that that was again, these are more case study bases because they were things that I've done, but I've seen it happen and talked with other people that have had success doing it as well. In terms of performance, core simply because the fact that the core musculature themselves are working in sync with the limb musculature, you end up having good quality limb speed. You have good limb strength, limb endurance, both upper and lower. All right, so with all of that, you can have better vertical jump performance. You can have, obviously jumping distance. It helps with speed and kicking performance. It helps with, endurance for those areas, so you can constantly repeat those motions. And there's been increases in, even something as simple as a 50-meter sprint has shown that. Now, understand that core musculature in a 50-meter sprint inside of the pool of, for swimming is really important, because now you're talking about non-weight bearing versus if you did like a running sprint where it's weight bearing. So in the pool, core musculature can help you with staying afloat and staying active in that whole process. Injury resistance wise, we're talking about making sure that the extremities move correctly. So therefore we can avoid that injury. It helps, core musculature helps with improved balance. So therefore you don't have that deviation from your center of gravity moving forward or back, or moving outside of your base of support. All right. So there's that stabilization of the trunk that helps with that. And then from there, injury resistance wise, proper core has actually shown, core musculature as, and having it less imbalance has shown to reduce the risks of things like ACL tears or other major structural damage. And then fall prevention as well. And then with rehab, last part of, before we get into some of the, the movements here, core training is really important for rehabilitation. We've said it speeds up that recovery process. What are we talking about? Restoration of the, like it says here, size, activation, and endurance of things such as like your multifidus, which is your deep spinal muscles, can help you with, rehab from low back pain, right? If you had it, or if you're coming back from it. Also, just core stability exercises have shown to have improvements of, with low back pain. Now, if you know who Dr. Stuart McGill is, he kind of works within that realm of creating positive core stability. And if you put in if you type in, and we can actually do that from here, just to kind of show you, we look at the search. If we said Dr. Stuart McGill, okay, we put in big three, you'll see here that there's a few videos that are there basically explaining what each of those big three are. And by using them, what ends up happening is they actually create a better core stabilization. And the three of them are the three exercises of the curl up, the side bridge, and bird dogs. And those are your three main exercises that we use to help enhance our really truly our core stabilization. And that's a good resource if you were looking for something like that. I know it's a little bit off of what we're talking about here, but having that information can help you tremendously, because it gives you a little bit more implication to what we're talking about. So how we can help too, and a lot of times it works within that what we call drawing in maneuver, where we're basically trying to take our belly button and move it all the way back toward our spine. That's a drawing in technique that helps enhance those local core stabilizers that we're trying to work with, to help activate them and to help them get strengthened. All right. So that's what your drawing in maneuver is all about, trying to basically take and just, enhance the core musculature of that region to promote a better stabilized area of that, basically those local muscles. Versus, now when we talk about abdominal bracing is a lot of what we call the global muscles, like the rectus and the rectus abdominis and the external obliques. Those allow those to contract on top of your diaphragm to basically set your spine so that you don't have that spine movement. You have good, proper spinal strength or core strength in that moment to promote a safe spine. So what we do is for bracing, we take a big diaphragm breath in, and what that does is it engages the rectus abdominis and the external obliques. And because the diaphragm's set, because we're holding our breath, and basically because those muscles are fired, we actually have what's called like a bracing, or almost like having our own human weight belt. And that's what will help us to stay in line for certain tasks that we're looking to do. But actually, to kind of go back a little bit, that also can be a really important thing for if you're just going to use this as a movement pattern as well. If you're going to try to work on just bracing, that can help with those more global muscles so that they will fire and they will start activating if you're using them just for the exercise portion. So what do we want to make sure of? Again, just like anything else, we want to make sure it's systematic, progressive, and functional for everybody. We're working on all range of motion for concentric and eccentric and isometric actions. So we want to make sure that it's planned out correctly. All right. We want to, again, get through, we want it to be multi-planner. So all planes of motion. We said full range of motion. We want to go through many body positions. We want to work on speed of execution, whether it be slow or fast, or somewhere in between. And then we want to be able to adjust, and create specifics for things like our acute training variables, which we lumped up to sets, reps, intensity, speed or tempo, and then frequency. All right. So by doing this, we can also create what we will call a proprioceptively enriched training environment where we can adapt to our body's movements based on specific stimulus. Okay. Although I'm not a huge advocate of it, Nasm truly is. A lot of these personal training certification bodies really are about doing unstable or balanced unstable training, like working on like Bosu balls and things like that. I'm not opposed to them. I just feel like they're more for the beginner through the intermediate who are working on enhancing this core training, and that's really important for that. If we're working with the elite level at this sense, so there's been a lot of research that shows that working on unstable training can slow down movements, which increases your chance of injury. So keep these things in your back pocket to know that check to make sure that unstable surface training or unstable training in general is right for each person. All right. Some will disagree with me, and that's okay, because that's really good that you disagree, because that means that you have a feeling toward it and you've probably backed it up with looking up information that's credible. Okay. So here's your variables. Okay. So again, all planes of motion to the top left, working within your sets to a, low, moderate, or high, and then we would adjust our low, moderate to high reps. So if we go low sets, we want to maybe go high reps. Moderate usually sticks with moderate, and high volume usually goes with low reps, depending upon what you're doing. Full range of motion, we could talk about, you can have partial range of motion, you can have end range of motion, depending upon what you're doing. Then we go into, little to no spine movement like a plank, all right, and then progress all the way to explosive trunk movements like a medicine ball rotational pass. Okay. Speed goes from slow to explosive, and use any of those. Resistance, just like anything, goes from just body weight only to heavier, and then using a multitude of different types of equipment can be used as well. Okay. And all of those variables can be used and adjusted and implemented in a way that works for everybody. So again, working on stability, muscular endurance, strength, and power. Okay, again, working with the proprioceptive base, making things what we call multisensory, all right, using different modalities, balls, bands, and other balance equipment like balance boards, balance beams, things like that. All right, for this purpose here, with anything core training-wise, we're looking at technique. We're looking at quality of movement versus quantity. So even if we are doing high reps, we want to make sure that they're done correctly and good quality, okay? And then the last part of this here, working on optimizing the sequence of function of the intervertebral stability, lumbopelvic stability, and then the movement efficiency. All of those will allow, when we design it, to be correct. So therefore you have proper spine motion, stability, proper LPHC, stabilization and movement, and then obviously the overall outcome of proper movement and good force output. So here we're going to get into the local muscles, the core training progressions. Here they all are. So I'm just going to kind of go down the line and then we'll look through them correctly. Marching, floor bridging, ball bridging, cobras, floor or ball, fire hydrants or clamshells, planks, side planks, dead bugs, bird dogs. Dead bugs are floor based where you're lying on your back. Dead bugs are on the floor. Bird dogs are just on all 4 points of contact, hands and knees. They're the same motion, just in a different format. One's more what we would say supine, one's more prone. Pull-off presses, and then your farmer's carries. And then going through your global and local muscle progressions. You're talking about floor crunches, ball crunches, back extensions, reverse crunches, knee ups, cable rotations, lifts, and chops. Okay, those would be your second set of progressions. All right, moving through full range of motion. Here, we're more worried about stabilization, so we're not going to be doing a lot of movement. We're talking more about stabilization of the spine, and it's not so much that it's isometric, but the just minimal movement. And then lastly, our progression 3, getting toward that explosive speed, medicine ball rotation, chest passes, medicine ball pullover throws, front med ball oblique throws, side medicine ball oblique throws, and then you're talking about soccer throws, wood chops, and overhead throws. And we'll go through all of those here in our chapter. So if we were to pull up our exercises, there's your marching. Now again, when you march in this way, your hips will slightly come off the floor, and that's okay as you march. But we're working on just lying down and marching with our feet. They should be slow and controlled. Floor bridging, just hip elevation, okay? Nice and controlled. Ball bridging is basically the floor bridge, but now you're trying to stabilize yourself on the ball. Provides a little bit more of the stabilization of that core region, meaning that the front and back have to be a little bit more engaged for that purpose. Floor cobras here, if you look, what we're doing is we're working on bringing almost like a half Superman, where we're going to engage the lower and upper back to be able to pull ourselves off the floor in a safe manner. There's your cobras, same, on the ball, same position, just on the ball itself. Fire hydrants or clamshells, now they're on this pad simply for, it's not so much that's to add more stability or more control. It's more about just making sure the knee is in a safe, compromised position, an uncompromised position, where it's got like a soft feel on it versus having to be on a harder floor. And then we're just going through abduction, just lifting those legs up, just like a dog peeing on a fire hydrant. Planks, we've seen those a lot. Again, going with I personally feel that the elbow plank is slightly harder than the upper push-up, the top of a push-up or the upper plank, but you can do either one of them as well. And then you can make them less or more, less challenging, but more for a beginner by putting them up on a bench, okay? Or against something a little bit higher. Or you can make it where the feet are off the floor and they're going more in an inclined manner, and that will make it more challenging. There's your side planks. We can do hip raises. We can actually say side plank, drop the hips and lift the hips. That would be side raises, side plank raises. There's your dead bug, opposite arm. See, this is a little bit different than anything that I've ever seen with a dead bug. Typically, we start with the knees in that 90-90 position, and then we have the hands almost like in a bench press position. And then, typically you don't start. Maybe I do them a little bit differently, but we usually start with both legs in that 90-90 position, both arms in that 90 degrees of flexion, and then you go opposite arm, opposite leg. So a little different variation than what I've normally done, and what I've seen across the board. There's your bird dogs, opposite arm, opposite leg, maintaining that stabilization of the spine. Kneeling pull-off presses, you can take that band. Now, a trainer can hold on to it, obviously. You can wrap that band around a bar, like a post for like a squat rack or things like that, and allow for it as well. Now, this is a kneeling position. You can do it standing as well. But here you'd be taking that, about sternum height, and all you're doing is stabilizing yourself. That band is going to try to pull you. And so for this person, that band is going to try to pull them to the left. So you got to maintain upright posture while pressing the band away from you. Now, pressing the band away from you, when that weight gets away from your center of gravity or the set line of center, it makes it more challenging. It puts more weight outward. So therefore, you have to control yourself more. And then farmer's carries, walking, a specified distance, trying to maintain upright posture. We don't want to be hunched over. We don't want to have forward head, elevated shoulders. We want to walk naturally and just keep that weight in our hands. So not only is it taxing our stabilization of our spine and hips, but it's also working on grip strength as well. Moving from, like we said, the phase 1 to the progression number 2, floor crunches, trying to keep that neck in neutral spine without pulling on it. Ball crunches, safer for most people than doing a traditional sit-up. There's your back extensions. Now, again, this person should not be pulling their head in any direction with, with the head. They shouldn't be driving their hands down or pulling your head back in that sense. Moving through the reverse crunch, you can do this on the floor. You can do this on, a bench like you see here, working on, again, they can be in the 90. Typically, the more advanced you go, you'll let your legs out all the way so they stay elevated or they stay just off the floor, and then you pull those knees back in toward the chest with a slight hip at the end. Knee ups, which are more about holding on, and sometimes you might see these called flag pulls, where you're basically lifting the hips off the ground more so than it is about you can also make it a little bit more challenging by lowering the legs, but depending upon your ability level. But here we're working more just on hips up and driving, those knees straight up. Your cable rotations, now they really do that pivot. You can do the pivot. It's actually a good complete range of motion, okay? Your cable lifts, okay, starting from that lower position, making sure they're getting in a good quarter squat, okay? And then raising up through, okay? And then you're going to go through and then move downward, or those chops, again, using that rotational piece, without compromising the knee or the ankle. And then we move into that progression number 3 with things like a rotational ball, basically a ball rotational chest pass. All right, moving and again pivoting on those feet, being a little bit more explosive. There's your medicine ball pullover throws. You can do these from a ball position. You can do them from a lying position on the floor. Okay, really working on trying to engage the abdominal region to fly that ball to either your partner or against a wall, just not drywall, because it'll go right through. There's your oblique throws I was referring to earlier in the lecture. Again, working on against the wall is always more optimal. You can work on throwing it to and from another person, but really engaging the external and internal obliques. Oblique throws again. Medicine ball soccer throws, we're working on that downward trajectory again and making that ball bounce off the floor. Hopefully it hits off a wall and then comes back to you, so it makes it a lot easier. Okay, and then wood chop throws, you're working on rotational, so coming down and rotating to a side. And then back, ball back extension throws, where we're going to be basically rotating all the way through. Okay, coming up and around and up versus up and around and down. All right, so these are your examples of your exercise that you can progress to, and we saw those in those lists. So then, of course, we always are looking for our kinetic chain checkpoints. So your feet, your knees, your hips, and your shoulders, and your head, making sure, these are very common checkpoints that we go through a lot, and we see this in each chapter. So we want to work on trying to get these correctly, okay? So working on those 5, looking for those 5 positions to make sure there's, proper muscle activation and to avoid injury, but make sure we're not seeing unwanted movements to try to correct them so they don't become bad movement patterns. So that is, chapter 16 with core, very important chapter, something that we cannot, take lightly, and everybody should be doing these types of movements no matter what you're doing. I don't care if you're a powerlifter, bodybuilder, if you're a weightlifter, if you're a CrossFitter, if you're a person who just, who does boot camp, if you're a person who does your own thing, they should always be doing something like this. Okay. So thank you for listening, and I hope you all have a great day, and we'll move on to chapter 17 soon. Have a great one.